me now for more insight is Dr. Lakshman Swamy. Dr. Swamy is a pulmonary and critical care physician. Dr. Swamy, we just heard in that report, people waiting to get their machines replaced may not get one until sometime next year. So what kinds of problems does this create for the millions of people that use CPAP machines and the many more waiting to get one?
Yeah, thank you. This is going to create ongoing problems. They're going to get a lot worse. There's so many new people diagnosed who are going to be waiting also. So the delays are tremendous in their impact and the downstream impact even. So let me take one step back. There's lots of people who use these machines, these CPAP type machines, for sleep apnea and a variety of other conditions. But it's not just treating the sleep apnea that's so important. It's the fact that, first of all, many people sleep so much better and perform so much better in their daily lives when their sleep apnea is controlled. And super important, so many really devastating chronic heart diseases and lung diseases are made worse or if you don't have this machine. And this is CPAP is kind of, if it were a pill, for the people who need it, it would be the best pill that they take. It has the least side effects and kind of does the most good. So it's a big problem that people aren't going to have their machines.
And you were telling me here, your hands are really tied as doctors.
Yeah, unfortunately, we're kind of like the point of contact for patients in the system for so many things. And patients come to us. There were already pre-pandemic so many delays and barriers in just getting diagnosed, getting the sleep study done, then eventually getting the machine. Those delays are all so much worse now. And as doctors, all we can do really is evaluate you and say, do you have a diagnosis? Can we write a prescription for a machine? And then the entire sort of medical industrial complex has to get that machine and get it provided to you and get you the teaching in your home. There's so many moving parts, and it's not like some things. We don't have machines in our clinics that we can just kind of hand out to people. It doesn't work like that, unfortunately.
And correct me if I'm wrong here, but this doesn't just impact people on CPAP machines. This also impacts some of the very devices you use in hospitals to help keep patients alive.
Yeah, I think that fortunately, I anticipate that'll be less of an impact in that particular space. There's much less. There's many fewer machines basically that we need in the hospital than the huge number of machines people need in their homes. But I am worried that if these delays and recalls continue to get worse, then it could start to impact that honestly life-saving care that we deliver in the hospital. I don't think we're there yet, and I don't think anyone should be worried about not getting that care for this reason right now.
And there's a second recall for Philips CPAP machines involving magnets in the face masks. So what's the issue there?
So, yeah, the issue, it's so frustrating to see yet another one, one on top of another. This one's not as bad in the big picture. So some of the masks that they make, so a CPAP machine is a little device that usually goes next to your bed, gets plugged in, and it essentially is pushing air through some tubing and into your face through a mask. And that mask is super important because it maintains a seal around your face so that the air doesn't just leak out, right? And so they're fitted really well for people, and having a comfortable fit in a mask is really important. Now, these masks have magnets in them, and those magnets, it looks like, can interact with certain medical devices or magnetic implants that people might have. So it is far fewer people, hopefully, who this is going to impact. Not everyone who has a mask that is recalled necessarily needs to stop using it. That's kind of a discussion that you need to have with your doctor and with the manufacturer, all those things. So many people will still be able to use it. And the good thing is that there are other masks out there. Masks are, I think, in more supply and easier to get, big picture, than these more sophisticated machines that work with the masks.
I know, Dr. Swamy, you said that patients come to you and say, what can I do? So are there alternatives that people with sleep apnea can try while they wait for a machine?
Yeah, unfortunately, this is the best medicine, and it's very hard to find something that can kind of compare without getting into really invasive stuff that is going to add a lot of risk. So for most people, they just need the machine. Now, the good thing is that this isn't a therapy that if you miss a day, if you miss some time, it's going to have immediate catastrophic consequences. No. You can go quite a few weeks even or months without it necessarily having a big impact. The problem is that that for some people, it's really important day to day. And for everyone, if it goes months and months, you're going to start to see problems from it. I think the important thing here is to say, go to your doctor and say, knowing that we can't just give you a mask, but what we can do is say, you know, if you're not going to have your machine for this many months and we don't know when you're going to get it, what are the other health problems you have that we need to think hard about that might get worse? What other kinds of closer monitoring might you need? So there is more that I think attention that can be put in there.
All right, Dr. Lakshman Swamy, thank you so much.
Thank you.